Hi, I'm Chris, and I'd like to talk to you about the use of visual aids in orthopedic medicine. As this video progresses, just keep track of the different uses of visuals that I mention. To many of you, a familiar visual that is associated with medicine may be a false skeleton. We see it in several different places, from a classroom to a doctor's office. However, we may not think in depth about its purpose. A good question to consider as a precursor to the subject matter I wish to talk about is, when did the idea of using visual aids in the medical world even begin? The answer to this question takes us back to Leonardo da Vinci, who was one of the great thinkers of his time, so to speak. His fascination with the human body led him to be the first to dissect a human cadaver. As you can imagine, Leonardo discovered many new things about the body. Thus, he was careful to document all of those specific findings which he found most interesting. One of his preferred media of recording his findings was to draw exquisitely detailed images of the body and its structure. These images were what helped other pioneers of the human anatomy to also progress in their understanding of the subtleties of how and why the body really works the way it does. One of the pioneers who drew on Leonardo's inspiration and work was Nicholas Andrei, who actually coined the word orthopedics to title a book he wrote about the theories of bone structure and deformity in children. I will skip forward now in time a bit because the real purpose of this video is not to talk about the history of how we got to where we are, but rather to describe where we are now and how visuals are used in orthopedic medicine today. As orthopedics has developed, a couple specific procedures became more and more frequently used, which are orthopedic knee and orthopedic hip surgery. The question of how doctors determine whether a patient needs either of these procedures leads to the first modern-day visual I will mention. The most common method of diagnosis requires X-rays to be taken. Visual aids like this image of a knee joint, along with a few other images of such a joint, can tell a doctor what is wrong with the patient and what the best way will be to treat it. The main reason for pain in joints is lack of cartilage, and X-rays will show that in full detail with little to no uncertainty. It is at this point that the surgery can be assessed as an option for the patient. In the event that surgery is needed, the patient will be educated using several different images and videos about exactly what the procedure pertaining to them truly involves. This is just like any other pre-operation patient preparation. At this point, I have to take another small tangent from the current conversation and move into the next part of this project, which is relating new age technology to current surgical procedures. As you may know, technology is a field in which advancements are being made in leaps and bounds nearly every day, and this most certainly applies to technology in the medical world as well. So what do you get when you cross a new age technology and age-old surgical procedures? Well, that combination will look a little bit like this. This is an example of one of the many new robotically assisted surgical setups that are used in the medical field today. A lot of you may be wondering about whether or not robots are advanced enough and really worthy of being applied to real-life medical procedures. In order to quell that doubt, this image shows a bit of the purpose of partial knee replacement procedure, along with what the end results look like. This is one of the many images that could potentially be used to inform the patient about what exactly will be done during the operation. Now, if you notice, the latter of the two images in this picture has implants in the femur and the tibia, which are top and bottom bone respectively. These implants have very specific designs that are made to optimize ease of use and reliability. In order for them to work properly, the surgeon must operate within a very small margin of error. The fit of the new components is vital to the patient's post-operation vitality. The robotically assisted surgeries have been proven to decrease the margin of error made during the procedure, and in turn decreasing the post-operation recovery time for the patient. In light of this new robotic technology, several companies and corporations have made haste to make their own software and designs for robots to be used for procedures. One of these corporations is Mako Surgical. They have developed software that, when combined with a unique robotic arm and display interface for the surgeon, is quickly becoming one of the forefront technologies in orthopedic surgery, especially for partial knee replacement. The reasons for this rely heavily on this interface I mentioned, which provide detailed use of visual aids to the surgeon before as well as during the operation. These next images show the pre-surgical images on the Mako system's display screen, which is generating a patient-specific image for the bone that will be operated on. This will give way to the next image that is used during the operation by the surgeon that tells him or her exactly how deep to drill the bone in order to make way for the new components that will be implanted in place of the old tissues. As you may have deciphered from the information I have been speaking about, there's a rapidly developing use of visuals in orthopedic medicine that is coming as a cause of advancements in new robotic technologies used to perform operations on patients. So thanks to early establishment of the importance of the use of visual aids in the medical world, new advancements in patient care and procedures are being made that will give way to safer and better medical practices.